All right. 1 in 10 Canadians waiting more than 14 hours in emergency rooms report. So this is something I expect to get worse. Uh, when like everyone talks about the oh, it's a demographic bubble. As the boomers get older, they need more healthcare, and the system is not growing to accommodate that. And everyone likes to talk about it. Nobody likes to do anything about it. And so it gets worse, and it'll continue to get worse until someone actually does something. And I have no idea if or when that'll happen.
Today from the Canadian Institute for Health Information is highlighting the strain on the country's healthcare system. It says 1 in 10 Canadians, or about 1.5 million overall, are forced to wait 14 hours when they visit an emergency room. And people who are...
So I don't experience this as a Canadian myself. I lived near Windsor. I brought this up earlier, but now that we're talking about it, I'll go through it again. I had it figured out. Like, unless it was an emergency, I didn't go to my local hospital. I drove an hour to a brand new hospital, and they managed their shit well. Okay, they did their job well. Like, you were in there less than an hour, usually like 20-30 minutes. You could need x-rays or anything, and like you'd get in and you get out. Great hospital. Like, the people that manage that one should be moved up the ladder, because there are some real messed up places that are not managed well. And apparently they're so unwell that we're now getting 14 hours in emergency rooms. Okay, and so that was back when I lived in Ontario. Now that I live in Alberta, I live in a small community. We have a hospital. Like I've waited like 40 minutes ish. There was one time I had to I was like getting blood work, and so I went in there to get the blood work done, but there was confusion, and the doctor that was doing it wasn't, or the individual that was doing it wasn't in. And so I sat in the room for like an hour before I went up and asked, and they're like, "Oh no, so and so isn't here today. They're sick." I was like, "Oh, well, that would have been good to know an hour ago." And I just had to set a new date for that one. But I mean, the times are fine. I haven't had to wait all that long.
Admitted to hospital could be in the ER for more than 2 days.
This is
the report
having an
says
issue.
Limited ER capacity, difficulties in accessing standard care, and the country's aging population are to blame for the worsening backlog.
Aging population.
So what are some of the lead factors? We've touched on some there that is leading to
what were they all?
For the worsening backlog. Limited ER capacity. Admitted to hospital could be in the ER for more than 2 days. The report says limited ER capacity.
Limited ER capacity. Emergency response. So these are like emergency beds? I mean, that's not an issue without the next ones.
Difficulties in accessing standard care. And
difficulties in accessing standard care. I don't know what she's referring to there.
The country's aging population.
Aging population is a big one. Old people go to the hospital more. That's just how it is.
Are to blame for the worsening backlog. So what are some of the lead factors? We've touched on some there that is leading to these long ER wait times. And what needs to be done? For more on that, we've reached Dr. Michael Herman in Ottawa. He's an emergency physician and spokesperson for the Canadian Association of Emergency Physicians. Thank you for making time for us today.
Thank you so much for having me. Appreciate it.
So first, I want to ask you, what was your reaction when you saw the data that came out in this report?
Well, I wish I could say it was surprise, but honestly, if you ask anybody who's been working on the front lines for the past 5 years, you know what it's like, and you know that this data really reflects what we're seeing. Yeah. We're seeing a sicker, more medically complex population, and we're seeing a population that is staying more and more in the emergency department after they're being admitted, to their detriment.
that's a lot of old people, right? An issue for a younger person. Quite often, like, you get treated and then you can go home. But that same issue for someone who is elderly oftentimes requires significantly more hospitalization. And right now we're in that demographic bomb, the demographic time bomb, where the big group of people, the boomers, are getting old and are now seeing more time in hospital. And so we're going to continue to see that, likely.
And to the detriment of the department itself.
When we talk about the numbers that have come out of this study, saying 1 in 10 Canadians, or about 1.5 million, are waiting 14 hours, you mentioned that that's not surprising, and some of the factors there, that we've got an aging population, that the access to care is more difficult, partially because of the resources. What needs to be done right now?
Well, the biggest obstacle in terms of flow in the emergency department is flow out of the emergency department. So where we really struggle the most nationwide is getting the patients in the emergency department who were admitted to the inpatient wards. And they're in turn blocked by patients who are admitted needing complex medical care themselves.
So that's a bed problem? Not having enough hospital beds? And so you run the issue of the hospital beds are full, therefore the emergency ward becomes more permanent than it's supposed to be, because it's supposed to be, oh, you go to emergency, all right, your issue is resolved, you leave, your issue needs further care, you're admitted. And that's the step that's holding them up, because the further admission is into a hospital where they don't have free beds. And so you can't admit them, and they're stuck there until you can get a free bed and get them in. So that's like hospital expansion.
Or patients who are alternate level of care, ALC, who have completed their medical treatment but need disposition either at home with community supports or rehab or long-term care that just doesn't exist. So we need to be investing in strategies that will allow
so people that you could move home, but long-term assistance isn't there because they would need care at home for at least a period of time while they recover.
Outflow from the hospital to proceed so that the inflow into the emergency department can continue as intended.
You know, I know that this report is doing a comparison here between 2018-2019 fiscal year to 2024-2025. And when we were talking, you mentioned the past 5 years, if you look at back then to now. You know, for me, when I think about this is something that we've been reporting on for decades, that we were expecting this because there was a big population.
We've been reporting on it for decades, have done nothing to fix it. We have watched this cliff from way off in the distance as we've drove right up and over it. At some point, somebody's got to fix it.
That was aging. We knew that this was happening. People get older. There's a big boomer demographic, and there was not enough people to fill the roles, to offer the care. Recruitment, retention, resources, planning, poor planning. I mean, how come nothing has been done in so many years? What do you think is the obstacle there?
I think it comes down to accountability, and we at CAPE, we're coming out with a position statement on overcrowding very shortly, and in it we highlight the key deficiency and the key implementation that needs to happen is accountability framework. We know about these things, but we don't have articulations of who is accountable for this, who is responsible for the various things that need to happen, be it home care, be it primary care, be it hospital flow. What are their deliverables, and what are the consequences for not achieving that? Without that kind of framework, we can talk about all these problems as much as we can, but we won't have a clear understanding of who is responsible and what are they responsible for. So fundamentally, that's what needs to change at every level of healthcare delivery, be that hospital, health region, provincial, and national, in order to give Canadians the healthcare and the emergency care that they deserve.
Well, you're on the front lines, Dr. Herman, and I know that certainly you mentioned that it doesn't come as a surprise to you, and so many other physicians in your position as well. They would say, we saw this coming for years and years and years. So to your point there about an accountability framework, what's taking so long in having that accountability or having something be done? Is there not the will from whether it's the levels of government or the people involved in this to make that change happen, because it has been a prolonged problem that has only become worse with time?
No, you're exactly right. And as to the question of will, I would turn that question to our hospital CEOs, to our health region leaders, to our provincial and federal elected officials. Where is the will? Where is the push to get this accountability? And I think we as a population, as Canadian citizens, need to hold our leaders to account to provide this and to provide the resources that are necessary for timely, high quality delivery of healthcare, both within the emergency department and outside of it. So I encourage everyone listening, write to your local officials, write to your representatives, and demand things be better, because they can be better if we push for it.
And how much worse do you think it can get?
We don't have to live like this. Very true. We can change this.
Because this is just a picture of the decline. We know that the aging population is continuing to grow now. What do you think it's going to look like in another 5 years if drastic action isn't taken right now?
I think we're going to continue to see the pattern of devolution that we're seeing, increased wait times and the mortality that comes along with it, because waiting in the emergency department for an inpatient bed truly has mortality risk associated with it. So without those changes, without the ability to get those patients out of the emergency department, we're going to continue to see risk to our patients. We're going to see increased delays, and we're going to see all the bad outcomes that come from that. But I do want to say that there is still chance for optimism. There is still chance for hope. Things are the way they are now, not because of inevitability, not because it is the way things are ordained to be. These are a result of policy choices, and the solution to bad policy choices is good policy choices, which I think is something we need to demand of people from top to bottom in our healthcare system.
Finally, Dr. Herman, I wanted to ask you, for you and your colleagues, how helpless do you feel when you see all of this happening?
It can certainly be discouraging, and to come onto a shift where half or 2/3 of your inpatient beds are occupied by admitted patients, limiting your ability to see that next undifferentiated emergency patient, it can be very disheartening. It can be a big cause of moral injury and burnout. But
the emergency, so when you come into the emergency room, you have emergency beds. This is usually like, you're treated here, if whatever it is can be treated in the emergency room, then you leave or you're admitted to the hospital. So the emergency beds are kind of the last thing you can use in a hospital. And when they're filling up, like, where do you put them when the emergency beds are full? I don't know. I don't have an answer for that one. Like he's saying, when you come in, there's like half of your emergency beds. What do you do when they're all full and you have an emergency patient? Yeah, I don't know what you do, and hopefully this will be fixed before we have to answer that question.
I'm so proud of my colleagues, my team, the people that are working in our nation side by side every day to, in spite of these austere conditions, provide great care to Canadians. So I take faith and I take hope in the fact that despite all of these challenges, we're still out there on the front lines looking after Canadians. And now we need our partners in the healthcare system to come meet us in that delivery.
Dr. Herman, I very much appreciate this conversation. Thank you so much for your time today.
Appreciate you having me. Have a nice day.
That is Dr. Michael Herman. He is an emergency physician and spokesperson for the Canadian Association of Emergency Physicians. He joined us today from Ottawa.
I mean, like, that's one you got to get on top of, because I don't want to answer the question of what do you do with an emergency patient when all the emergency beds are full. Do you start rolling out stretchers, like the wheelie beds, and start just putting them in the emergency waiting room and treating people out there? I imagine that's probably what would happen, but that's not a long-term solution to this problem. Using the emergency beds is not a long-term solution to this problem. This problem needs a solution. And it sounds like we need to change policy to get that solution.